was invasive cardiology, and I didn't switch to non-invasive because I think it's better, although I do feel prevention is huge. But we do sometimes need some invasive measures when we get into trouble, and that's because we haven't perhaps practiced the fundamentals of good health, which have led us into states of disease which then need more aggressive measures to correct. And thankfully we do have some technologies available to us, otherwise half of us would probably be dead with the lifestyles we lead. So this is the heart of the matter, and Joey very quaintly put, let's bring our attention to the hearts. And why is he asking us to do that? And I'm going to get a little bit more into the details of why that is. So right now, actually this is data from 2012, heart disease was deemed as the second leading cause of death in Canada. So we think Canadians are actually probably faring a little bit better lifestyle-wise than our US partners, but it's the second leading cause of death. So we need to understand where we're going wrong. The first leading cause being cancers. Globally, it's actually responsible for 50% of deaths that are of non-communicable causes, non-infectious causes. So it's a huge burden of cardiac disease. This includes not only ischemic heart disease, but heart failure, the two big killers in heart disease. So Udavartha, if you remember, was a scholar from 600 AD, and it is thought that he lived about 135 years. So we have Charak Samhita, and then we have Sushruta, which brought us the surgical aspects. Udavartha contributed some of the clinical context of the Charak in around 600 AD. And he coined some of the heart disease, he classified some of the heart diseases in those writings. It was thought he was the principal author of the Ashtanga Hridaya meaning heart, but I believe there were multiple authors on that. I don't know, none of us were alive then, so we can't say for sure, but this is what has been said. 85% of diseases of the body, he said, did not require a doctor. And again, that was back in their times, I'm not sure about now. But I do feel if we, again, focus on the basics and fundamentals of what Ayurveda is bringing us, we can alleviate many things and prevent having to go to a doctor in the first place. So he did say that the heart is a Sadhya Pranahara Marma, and if you're familiar with Marma points, there are 19 Sadhya Pranahara Marmas in our body. And those Marmas are those that if you hit with direct contact, it results in instant death. So the heart is thought to be one of those marmas. If you hit in the vicinity of a Sadhya Pranahara Marma, you may not result in immediate death, but you may have a slower, more protracted course of illness followed by death. So these are very important marmas and need to be respected and need to understand what is making them tick, no pun intended, or pun intended. So he also said that the heart is the size of your fist. So can everybody just hold up their fist? This is actually fairly accurate, and I can tell you from doing several assists on bypass and transplant and even autopsies that from what I see, this is quite accurate. The size of your fist is the size of your heart. If it's larger than that, it could be because of excessive exercise or a disease. The excessive exercise perhaps is not pathological and can be reversed, but the disease state certainly can result in either a massive heart muscle increase or just an overall increase in size of the heart, so then we know that we're in a more diseased state. Of course, we're not cutting people open to check the size of their heart, but on physical examination, you can get a good sense of the size of the heart, and I'll go into a little bit more detail shortly. So now, coming back to what Joey said, let's bring our attention to the center, bring our attention to the hearts. Why do we do this? Can anybody tell me why we do this? The answer is kind of on this slide, but anybody have any thoughts as to why we always, when we meditate, we try to bring, well, in some meditations, we bring our attention to the center?
To align with our home male female energy?
Yes. Okay. So it's right there. It's the seat of prana, it's the seat of ojas. And actually the heart, the fundamentals of the heart are both physical and emotional properties. So it's not a coincidence that when we speak of the heart, we speak of emotional matters. It's actually a fundamental principle of the heart. There is the emotional heart, there is the physical heart, and we actually need to nourish both sides if we want to achieve ultimate heart wellness. So being the seat of prana, what is prana? Prana is our life energy. And prana is maintained by a delicate balance between our sun energy, the solar influence, and the lunar influence. So if one of these is off whack, we're going to have a prana that is out of balance as well. Ojas, which is basically our finest byproduct of digestion, the finest end byproduct of digestion, in textbooks we sometimes think this is a physical substance property. It's one of the tail end of the dhatus, the sapta dhatus. But in fact, there is a huge emotional component to ojas. And so a balanced ojas leads us to bliss, contentment, longevity, vitality, and it is also nourished by the emotional component of the heart. So we need the lunar influence, we need the solar influence, we need to bring them in balance, we need to balance our prana, and we need to have a strong ojas. So we can't just go through life, nourishing our diet and exercise and all those fundamentals. We also need to nourish the emotional side, which is very much a part of us. So the heart is also governed by 3 sub-doshas. Sadhaka pitta is very much a target when we're looking at herbal therapies and heart disease. Avalambaka kapha, which results in stability and strength. And Vyanavata, which is responsible for blood flow and the beat of the heart. So these are present everywhere in the body, but the actual seat is in the heart for these sub-doshas. So in some textbooks it's spelled as Shrudayam with a U, and some textbooks it's spelled with an I, so I may use them interchangeably during the slides here. But the heart has 3 vital functions in Ayurveda context. Harati, Dadati, and Yati. So Harati, it collects the blood. Dadati, from the Sanskrit, it gives the blood, which it has collected earlier. And Yati, it circulates the blood to the whole body. So to make it very simple, these are the 3 vital functions. But you can imagine if something goes wrong with any one of these 3 vital functions, we'll have a problem. Because we need to circulate oxygen everywhere, oxygen, nutrients, whatever, to sustain us from a physical standpoint. So embryologically, where are the tissues derived from? If heart is the seat of ojas, it also contains the other dhatus. So the endocardium, is everybody familiar with anatomy of the heart, more or less? So we have the heart tissue, we have the muscle, we have the left ventricle, we have the right ventricle, we have the valves here that you can't see, the semilunar valves, which is the aorta leaving the heart, the pulmonary valve leaving the right ventricle. These tissues that you see here are the cords of the 2 tricuspid valves, or the 2 semilunar valves, the 2 AV valves, which is the mitral valve and the tricuspid valve. We have the muscle of the heart, we have these coronary arteries coming off of the aorta and going back to feed oxygen to the heart muscle, and then we have the great vessels, which is the pulmonary artery and the aorta, with all the branches that come off of it. The endocardium is the lining of the inside of the heart, and that is derived from rasa, the body fluids, and rakta, or blood, during the developmental phases in the fetus. The myocardium, which is the muscle of the heart, is derived from mamsa dhatu, or the muscle, and the pericardium is derived from the meda dhatu. So you can see everything is sort of involved. We could go further into this, but again, the seat is the ojas. So it's actually called as a gulma, so a ball of dosha is the heart. It's a combination of multiple doshas, multiple dhatus, and the seat is the ojas. So it's a very, very important organ. It's also one of the Three Marmas. If you're familiar with Three Marma, the bladder region is the lower Marma, the heart is the central, and the head, the shira, is the upper Marma. So it's one of the Three Marmas in line with our chakras. So a very, very important organ. So now I'm just going to give you a little comparison. Don't be overwhelmed by this slide. Let's focus on the first 3. But this is a classification of diseases from both an Ayurveda context and an allopathic context. The Ayurveda context of classifications of heart disease changes over the years. It has changed many times. However, it is never out of sync with the modern medicine classifications. It's always very similar. So if we look at the top one, Adi Bala Pravruta. So Adi meaning first, similar to Adi Yogi, first yogi, Shiva. Adi is the first. So that's an easy way to remember it because it's our hereditary disease. It can basically be what has happened at the time of conception. So we have genetic material from our mother and our father that is combining in a certain way to form a hereditary pattern, and those genes then become expressed in our body and result in some form of hereditary disease. So the time of conception. If we go a little bit further and we look at Janma Bala Pravruta, and what does Jannah mean in Hindi? It's birth, so in Sanskrit similar. So Janma Bala Pravruta means congenital, means this is present at the time that you're born or during pregnancy. So similar to our Prakriti, we have these congenital abnormalities that can be present at the time of birth. And these are defects that are perhaps occurring during pregnancy. They can be because of illnesses of the mom, illnesses during, not inadequate nutrition, or other malformations that can occur for various reasons in the development of the growing fetus. To give you an example, this might be that when the heart forms in the fetus, basically the left and right side are coming together. And as they come together, they fuse in the middle, and then they rotate. So you have the pulmonary artery coming up and the aorta behind. And in the center of fusion, you have the middle portion of the septum, which is the central part of the muscle here. So this is fused together. If this doesn't fuse properly during development, you'll have various holes in the muscle. So when people say they've had a hole in the heart, usually it's either the atria or the ventricle or lower down somewhere, or they could have multiple holes. Some of the babies don't make it into adulthood. Some of them have a tiny hole that they can live with, and others have a huge hole where the oxygenated and deoxygenated blood are crossing, and those need to be surgically corrected. Otherwise, they result in early death. It could be at age 2, it could be at age 12, it could be at age 20, depending on the severity of the defect. There's numerous other congenital diseases that can happen with the heart. We see tons of them. And now, actually, because most of the invasive surgeries on congenital heart defects were happening in the early 70s, all those people are now reaching 30s, 40s. The ones that have survived are reaching 30s, 40s, and they're coming to see us as general cardiologists, and we're saying, hey, I don't know, because we didn't start out treating congenital heart disease. So now all these adults are coming with these treated congenital conditions, and they have varied pressures across the aortic valve, across the mitral valve. The hemodynamics are somewhat different, so it requires actually a super specialized field to really understand what's happening with a repaired congenital heart disease. But we're now seeing them more and more in the community because they're reaching the age, because the surgeries were started in the 70s and 80s. Prior to that, they would have died in their 20s, and you wouldn't see them reach adulthood. So we have no understanding of this until very recently. So the third one, in Ayurveda, the dosha bala pravruta is the vata, pitta, kapha, sanipataka, which is the combination of all three doshas, is of course, as we understand in Ayurveda, the cause for disease and the cause for the vikrutri, where we're deviating from our prakriti. So now, the remainder of them on this slide are basically, could be resulting in an impaired dosha balance. We could be throwing our doshas out of whack. So we have traumatic causes, poisonings, we have environmental or seasonal causes that we're not attending to properly. We have infectious diseases, of course, endocarditis, myocarditis, pericarditis, so any portion of the heart, whether it's the outer lining, the inner lining, the muscle, the valves, they can all be infected by infectious diseases. We have also natural diseases, aging and death. Psychological factors, which are huge, especially in our Western societies, where with so much emotional stress happening in our lifestyle. So they can cause heart disease, hypertension, diabetes, obesity, addictions, so many different things. And then we also have Devabala Krita, which is deemed as idiopathic. Basically in medicine we say if it's idiopathic, it means we have no idea why the patient has disease. Similarly, in Ayurveda, it's thought if you can't find a cause, you can't find it in the congenital or hereditary mechanism, you can't figure out why this patient has a disease, we think possibly it could be due to previous karmas, previous deeds, previous lives, and actions. So every action that we perform, karma is basically action. Every action that we perform is thought to have a consequent reaction. And if we don't experience that reaction in the same lifetime, it is thought that we are experiencing it in the next lifetime. And so we result in these different idiopathic conditions in an Ayurvedic context. So it's very important, as you can see from all of these things, that when you, as a practitioner of Ayurveda, that you pay close attention to the history. And whether it's modern medicine or Ayurveda or naturopathic medicine, your examination and assessment of the patient starts the moment you lay eyes on that person. So as soon as they walk in the door, 90% of your diagnosis is probably made right there. You see whether they're short of breath, you see whether they're sweating, you see the look on their face, you see whether they're anxious, are they happy, how are they walking, how are they holding their body posture, are they reserved, are they open, are they limping, do they have a gait, did they break a leg? are they blue, are they pink? There's so much can be gained by pure observation of that individual walking into your office. So 90% of your diagnosis is right there. The history that you're taking should be very thorough and detailed, just to help you confirm that what you're seeing is true. Because have you ever seen a person you walk up to and they're nice and friendly and happy, but deep down maybe they don't like me? So I think all of us may have experienced that at some point in our life, but their mind is giving them a thought about you. Their emotions will always match the thought. So their mind and emotions are in sync. They know maybe for something about you rubs them the wrong way, but they may not be showing it on the face. So similarly, even though you're making 90% of your diagnosis when they walk in, be respectful of that 10% where you might be wrong. So take a thorough history, find out what's happening with the patient, find out, everything that happened before, understand their childhood, their upbringing, understand where they come from, and once you've done the history, you still have a little bit more investigating to do if you really want to be accurate before prescribing a treatment, and this requires a lot of time. So in cardiology, the latest guideline that we follow when we look at heart disease, because they're coming to me usually in a very ill state. So we're in prevention, yes, but there's a certain bias because they see the frontline ER or they see the family practitioner first. They already have a state of disease by the time they're sent to me. So we see patients who are at risk. So right now they have no evidence of structural heart disease, but they have huge risk factors for structural heart disease. They may be diabetic, they have high blood pressure, they are obese, they smoke heavily, they have high cholesterol, they have a family history, and yet nothing has happened yet. So they come in, we do their stress testing, we check certain other things, we make sure everything's in balance, we check their blood work. And then they reach a point where they may come to me for the first presentation and they already have structural heart disease. So they have risk factors, they have structural heart disease, but they don't have any symptoms whatsoever. So they're walking around thinking that they're completely healthy. They come for a routine checkup. Blood pressure's high, the cholesterol's high, so I know they have risk factors. They have no symptoms. Their history doesn't suggest that they have anything unusual going on other than these risk factors. But then you examine them, and on physical examination, what do you find? You find an enlarged heart, you find an irregular rhythm, you find a rise in the venous pressures, you find a swelling of the extremities, crepitations in the lungs. You find things that suggest either heart failure or heart disease. And so you can begin to treat them aggressively, and at this stage of the game, some of the things may actually still be reversible. So the physical examination becomes exceedingly important. Again, patient walks through the door, they seem okay, they give you the history, they seem okay, you examine them, you find a problem, you can still reverse their disease to some extent. So that's where that stage becomes very crucial. And it has to be accurate, it has to be detailed. And then they reach a point where they come to me and they have severe symptoms, and they have structural heart disease, and they have all the risk factors. Even at this stage, some things are reversible. Some may not be reversible, but we certainly have many different treatments, which we can use both on the Ayurvedic side as well as the allopathic side and naturopathic side, which we can use to improve the quality of life, sometimes reverse disease, reduce mortality. And again, we have invasive therapies, so defibrillators, biventricular devices, pacemakers, assist devices, many things that we can use if they're really truly in the end stage of heart disease. So this is the way we approach it in allopathic medicine. And where we approach it in Ayurveda is usually somewhere at risk factors, or here, or here. So again, all three. And it depends on how the patient is presenting to you. So in the Ayurvedic context, in the Ashtanga Hridaya context from 600 AD and even earlier, there are 5 types of Hridaya rogas, 5 types of heart diseases, roga meaning disease. So Vata, Pitta, Kapha, Sanipata, and Krimi. So the last one is really Krimi, meaning worms or bugs, is essentially our infectious causes of heart disease. So leaving that aside, we're looking at the main imbalances of the doshas. Sanipata, meaning all 3 doshas are present in the heart. And again, the heart is similar to a gulma. It's a ball of dosha. It can have everything. And we looked at how the tissues are derived from different dhatus, and the seat is the ojas, but everything is there in the heart. So we can actually have everything coming together in one. And that needs to be also taken into consideration when we're treating this, because we can confuse things easily if we don't have an understanding of the mess of dosha that can occur in the heart. So the Vata Hridaya Yoga basically is similar to what we know of Vata symptoms. So the patient who already has symptoms is coming to you. They may have severe pain, tearing, pricking pain over the chest. They may collapse. You know, sometimes people come in to see me the first time and they go to use the restroom, they come out and they die. So it happens. You know, people die of heart disease and they die suddenly. So circulatory collapse, which is a severe end stage of Vata Hridaya Yoga. Increased heart rates, heart failure, inability to bear loud noises because they're in a weakened autonomic nervous system state, so they can't tolerate heavy stimuli. We'll talk more about the autonomic nervous system. But they tremble, they twitch, they have diaphoresis, which is basically sudden sweating for no particular reason. They may have a loss of consciousness. They faint easily because the heart stops, or abnormal rhythms, or the blood pressure is low. They have jerks or stops in the motion of the breath. One of the types of breathing that we see when people are a week before dying is called a kusmal breathing. And it's coming from the central respiratory center, where you have these deep and rapid inspirations and exhalations. And the body naturally goes towards this state as a lower metabolic state as it's slowing down towards death. If anybody's lost a close one and they've been with them at the time of death, you may see that the pattern of breathing has shifted towards the end stages. So this is an impairment of the autonomic nervous system. And also it prepares the body for exhalation and finally leaving through whichever chakra you may leave through, but it prepares the body for that final exhalation and leaving state during death. So they may also have a loss of sleep and fear, and these are all Vata rogas that we know of and we treat every day in Ayurveda. The Pitta roga, which is thirst, vertigo, heat, unconsciousness, gastric reflux, vomiting of the gastric reflux, and a sensation of indigestion. How many people do you know went to the emergency room and the doctor sent them home saying, don't worry about it, you just had heartburn, you're not having a heart attack. They ate a big spicy meal at night, ended up in the ER. So these are all Pitta kind of doshas, but again, the Gulma, it presents with the similar symptoms of the heart. It's in that same area, so we have to be aware. There are many things that can mimic heart disease. It doesn't mean that everybody has heart disease if they have the symptoms. They may have stomach issues, they may have muscle issues, they may have neck issues. A lot of things can cause chest pain, so we have to be aware of that. Paleness of the body, fever, those are more the infectious causes. The Kapha roga, again, failure of the normal motion of the heart, so the heart becomes weakened. The heart rate may be very slow. We see this in patients with low thyroid conditions where the metabolic rate is so low, the heart rate is really slow. But also within the cardiac structure, you may have slowing down of the heart rate because the conduction is not functioning. So as people get older, we get calcium on the valves, calcium on the conduction system, and that also slows the heart rate, and they require pacemakers sometimes. So cough, why does cough happen in heart disease? Generally happens more in heart failure because if the pump can't push blood forward, the blood is accumulating and sitting back in the lungs, and it results in a cough because the lungs now have filled up with fluid, and we need to get rid of the excess fluid. So we have a bit of kapha now in the lungs as well. Lethargy, anorexia, fever, of course, if you're not functioning properly, you're not getting oxygen and minerals where it needs to go as quickly as it needs to, and so you're going to feel weak and lethargic and tired. The Sanipata Hridaya Yoga is basically the symptoms of all three doshas are present in varying degrees of severity, so you just need to check everything. Crimage Hridaya Yoga, blackness around the eyes, darkness in front of the eyes, atrophy, itching, tension, throbbing, ripping pain, numerous things that you see sometimes with infections as well. And again, we talked about the thorough physical examination. Does anybody want me to go in more detail on how to examine the heart, or are you all familiar with how do you examine your heart?
Sure.
Should I go through some of it? So, like I mentioned, when they come in, we examine the patient, we see what they look like. Your observation is, trust your observation because your first instinct is usually correct. So we always lay the patient on 30 degrees. And why do we do that? Is because the venous pressures are, if the fluid starts to rise in the body, in the lungs in particular, in the 30-degree angle, you'll be able to see it very clearly along the neck, along the jugular venous pressure. So you'll see this as a pulse, a venous pressure. And you can tell whether it's 4 centimeters or 5 centimeters or 6 centimeters or the angle of the jaw, how much pressure is sitting in the lungs. So that is the first thing we do in a cardiac exam. We lay them 30 degrees, we evaluate the JVP. If it's elevated, we know already they're backing up fluid in the lungs. Now we have to figure out why they're backing up fluid in the lungs. So before you place a stethoscope on the chest, You're going to place your hand, your palm, right over the heart, just under the heart, and you feel under which finger do you feel the apical impulse of the heart? Does it feel like a big quarter booming on your heart, on your fingers, and then it takes a second, it's sustained, and it falls back? Or is it just a tapping? If it's, you want to also feel where the position is. If it's further towards the axilla, if it's lower down, if it's towards the center, you know the heart's enlarged. If you're feeling it all the way in the left, not in its normal position, you know the heart's enlarged. If it's tapping, you know the heart is weak. If it's sustained and really strong, you know the heart muscle is thick. So it's really common sense things that you feel on your fingertips that will tell you which part of the cardiac structure is impaired. And then of course we're going to feel for bruits. You can feel, put your palm on the chest, and if this person has a very prominent murmur, you put the palm on the chest, you'll actually feel the murmur. It's called a bruit when you don't listen with the stethoscope. So you'll feel a vibration going through your hand. You can do that with your fingertips as well in the different rib spaces, and you can feel the murmur. And then we use the stethoscope. So we go in and we find exactly where the murmur is happening. So you want to put your stethoscope over all four positions, all four valves. So the mitral can be all the way over to the axilla. The tricuspid is more central. The aorta is up higher, and so is the pulmonary. And once you've located the murmur, you want to follow that murmur in steps. Where is it radiating to? Is it radiating up into the neck? Is it radiating to the axilla? Is it radiating to the right? Because that's going to tell you where at first you hear the murmur. You know there's blood turbulent flow there. But where is the blood going? And by doing this in steps, you can figure out, is it moving anteriorly? Is it moving posteriorly? Is it moving to the right? So you can figure out without using an echo exactly where the leak is, where the stenosis is, and which direction the blood flow is moving in. So now, those are the basics of physical exam. I can go into more detail if anybody's interested on looking at things. But you have to see a lot of normals to be able to recognize the abnormals. The big things like murmurs and JVP, you can pick up very quickly, and that at least gives you an idea of heart failure, murmurs, regurgitation, stenosis, extra beats. You want to listen to hear if the heartbeat is actually regular. And now these days patients are coming in with the new Apple Watch. Does anybody have it? Okay, so the new Apple Watch has an ECG feature. So not only is it checking heart rate, but they're coming in with their ECG saying, hey, my ECG's abnormal. And I'm like, okay, stop using this. So we're getting lots of patients doing that now. It's a bit of a nightmare. But thankfully, it's not approved in Health Canada yet. But it will be in the coming 6 months. But I've had US patients who have it and come in. So anyway, that's a whole other chapter. But so Hridaya is the Three Marma, as we talked about, the Basti being lower, the Shira being the head, and the center Marma. It's the seat of Rasavaha, which is blood fluids, and Pranavaha Shrotas. It's the seat of Sadhaka Pitta and Ojas, we talked about. It's a Gulmasthana, it's a ball of dosha, we talked about this also. It should be treated with an understanding of Udavartha, Gulma, and Trimarma. So what I mean by that is, if someone comes in and they've broken, let's say they've injured their knee, you'll find that we don't just do an x-ray of the knee to check for fractures. We always do the knee above, we always do the joint above and the joint below. Because when you've affected one structure, you can affect the surrounding areas. So similarly with Trimarma, you want to understand when you're examining the heart, what's going on below and what's going on above. So it doesn't just stop at a focused cardiac exam, it's the whole body essentially, but specifically focusing at the surrounding points. You also want to look at it from a standpoint of Udavartha. So Udavartha is a backward or reverse movement of Vata. Some of you know this. So sometimes patients will come and say, I have this funny rising feeling in my chest. I don't know what it's coming from. This could be Udavartha. It could also be other symptoms of chest pain presenting in that way. So you want to be aware of these things so you don't misdiagnose something that could be simple. Again, they end up in the ER with symptoms of Udavartha and they're not having a heart attack. But we end up doing these expensive tests, invasive tests on them, whereas a simple history, physical examination, proper storytelling will give you the idea of what's happening with them without subjecting them to a million different tests. Of course, you want to be safe, and you want to make sure they really aren't having a heart attack, and some of that is just clinician confidence. How confident are you to say this person's not having a heart attack? And if there's a shred of a doubt, you're obviously going to check them. But it's just clinical acumen, and unfortunately we become our best clinicians right before we die because it's a lifelong learning process. We don't stop learning. So we're the best that we're going to be right before we leave, ironically, but that's why a lot of people don't retire. They get to 80 and they say, I'm just going to keep practicing because I've spent 60 years learning this and I don't want to just throw it away now. So they keep, whether they're practicing on their friends or family is another story, but they keep practicing, right? So we need to be respectful of Hridaya Roga. It could be occurring with a combination of different things. The Vega Dharnya, is everybody familiar with what this is? So the 11 urges. So there's 14 urges that need to be suppressed and 11 natural urges that should not be suppressed. The natural urges being, vomiting, belching, flatulence, similar urinary function, bowel function. But the suppressible urges are, the lust, greed, anger, hate, those types of things. So when we have an impairment in these Vega Dharnya, a lot of them arising from the mind, it produces heart disease by aggravating the Udavartha. So the natural urges should never be suppressed, and the Manasika urges need to be suppressed. But if there's an imbalance here, we're going to develop some form of heart disease. And that brings back the whole emotional component of the heart. So we need to pay attention not only to the physical side, the natural urges, but the mental side as well, the emotional. So it all brings it back. Everything is sort of connected. So the more in-depth you go into this, you realize that it's basically talking about the same basic concepts. And when you bring yourself back out, you see the big picture. It's just like when you're painting. So if you've painted or sketched before, you come in very close, you're spending an hour on these details, and then you take a step back and you say, no, that's not what I wanted to do, and you go back in. But you constantly have to come in and go out, come in and go out if you really want to get the big picture of what's happening. Same with the heart. So again, we talked about these 3 doshas, the emotional balance, stability and strength, blood flow and heat, blood flow and the beat. And the reason I mentioned that is the treatment is basically focused on nourishing soma, nourishing ojas, and the 3 doshas that are out of balance. So there's numerous herbs. We can go into detail for days about the herbs that can be used in cardiac conditions. The 2 that are most commonly used, I would say, especially in the Western world where we don't have access to everything, but most commonly used and probably the most powerful for heart conditions are Arjuna, which nourishes the physical and the emotional heart, and Guggul, which we know decreases cholesterol. And many naturopaths, I believe, also are using Guggul in their practices now. It's in some supplements. I've seen many supplements for cardiac supplements contain Guggul as well. But there's numerous herbs that can be used, and of course the herbs, depending on their own constitution, will help you decide which dosha you're using it in, but it requires a better understanding of plants and herbs. So to make it simple, what do we see now in heart disease that was different perhaps than 1,000 years ago? Maybe 1,000 years ago they saw a lot of heart failure. People were dying earlier, different types of disease state. This is what we see with our Western diet, Western world, Western influence, what's happening. High blood pressure, diabetes, obesity, sweating and heat diaphoresis in people with aggravated pitta, and you see elevated cholesterols, which is a kapha aggravation. So these things are very, very common. Second leading cause of death is heart disease, and a lot of it is driven by ischemic heart disease, which is accumulation of cholesterol in the arterial wall, which is a kapha aggravation, which could be vitiated by vata or happening on its own. So a lot of it has to do with diet, environment, and again brings us back to this emotional stress playing a role here, physical aspect playing a role here. So not only do we need to have the buildup of cholesterol in the kapha element, we also have the emotional element, which is now aggravating it. And in medical science, it has been shown that not only is the high LDL cholesterol a problem, but the inflammatory markers also have to coexist. If you have a high cholesterol but zero inflammation, you might be okay. But if you have a high cholesterol and high inflammation, it's a recipe for disaster. That's why smoking is so bad. Because one single puff of a cigarette can result in free radicals lifting up a soft plaque that's sitting in your artery and results in a massive obstruction, massive heart attack, and sudden death. You see this in smokers all the time. So we need inflammation, and we need the physical aspect. The inflammation is often driven by our emotional stress states as well. So it brings us again back, look at the big picture of being solar energy, lunar energy, physical, emotional, everything again comes together, even when we go into the very basic science details. So very important, this is what we see now. And I just wanted to spend some time talking about the 7 common sense ways to keep your heart healthy. So we need to soothe away stress. So stress, as I just mentioned, is a huge problem for us. So we need to make sure that we're taking time every day, getting rid of anything that is our stress. Anything we perceive. This doesn't mean we manage our stress. We don't want to own the stress. Stress is around us and in our lives, and we need to find coping ways to deal with that or eliminate it. We want to cultivate the positive. So inner strength, poise, confidence, happiness, contentment, they all build your ojas. If you build your ojas and you build a positive attitude, you're gonna build strength in your heart. Reduce inflammation. It helps with overall well-being. You want to eat right. So what does eat right mean? What does it mean when we eat right? We know from Ayurvedic naturopathic perspectives, we have to eat the right foods, we have to choose the right foods. The farther they have deviated from their natural occurrence in nature, the worse they're probably going to be for us. So we want to choose fresh food over processed food, over leftover food. I would say, at least the processed food might be sun-dried and powdered, somewhat closer to nature than leftovers. They're sitting in water in a cold, heavy state the next day. So fresh food over processed over leftovers. You want to choose light foods over deep fried foods, which are filled with toxins. Who knows how long the oil's been sitting there and what kind of oil that state is. Was it a balanced, heated state? And what kind of toxins are in there as well? Plus the saturated fat that goes with it. You want to choose warm, cooked foods that are nourishing to your ojas versus cold, heavy, dense foods. You want to add spices during certain seasons like black pepper, turmeric, which is a powerful antioxidant, we know. Numerous other antioxidant herbs we have. Simple things you can do with the diet to eat right. Add a lot of fresh vegetables and fruits. The doctor will always say, add colors to your plate. It doesn't mean you have to eat everything raw. If your vata is aggravated, obviously you don't want everything raw. But you want to have something close to nature. So you steam it, you bake it, you bring a little warmth to it, and you consume it. You're going to get the most vitamins and nutrients that way. We want to eat mindfully. So how many of us go out for dinner with our friends and do this regularly and sit in a restaurant? How many people have gone out in the last week to dinner with their friends? Okay, so half the crowd. We do this all the time. And what are we doing to ourselves? So we go to this restaurant. Usually it doesn't have carpets. You hear the clanging of the utensils everywhere. If you're sensitive like me, it'll drive you crazy. But I like to be in a quiet environment when I eat. But you're going to the restaurant, it's loud and clangy. How loud are we speaking to our friends because we can't hear anybody? Everybody else is talking. Your food's here. Everybody's talking over your food. Some of the conversation might not be so good. Negative thoughts, negative emotions are all over your air in the table, on top of your food. Now you're consuming the food. You're not breathing in between because you're talking to your friends. You may even choke on your food while you're eating it. If you don't choke, you're not swallowing or chewing properly, and we're digesting this. That's becoming our body. It's a sacred event. I don't know if any of you know Sadhguru, but Sadhguru says, when you consume thinking, this is becoming a part of your body. The banana is becoming a human. It's a sacred event. Your body's intelligence is turning it into a human being. The cells are being nourished. If we're adding so much chaos at the time that this process is happening, it's invariably going to cause disease. And how many have gone on a picnic and feel that eating outside for some reason feels so much better than eating indoors? Why does the food taste better? Because we have the solar element falling on us, falling on the food. We're closer to the ground. We're just in our own natural element. And you're eating outside and it's quiet and you have fresh air, lots of oxygen. So your body's telling you what it wants. It's just that we constantly are ignoring the signs. We're not ignoring them because we don't know any better. We know better. We're ignoring them because our whole society has created this infrastructure for us. These nice restaurants, we go out to eat, or we get dressed up, we go socialize. It's a whole social culture. But if you're really seeking true health, you can't do these things. You have to almost become a yogi and go inward, Then people will say, well, I can't function in society if I'm doing this. Well, pick your poison. You do it and you suffer the consequences, or you don't do it and you gain health. You build your ojas, you build your strength. And if you build those things, you can go out in the world and you can do more things. You can affect more people, but if we're constantly breaking ourselves down, we're not going to achieve those things. We have to eat mindfully. And we have to maybe even say a mantra, improve the vibration above your food before you consume it, because it's entering your body. So you can say small mantras to your food. You can even chant Om just to settle the air, before you eat. Little things, I really believe they go a long way. So cleanse the ama from the physiology. Now, seasonal cleanses happen in Ayurveda and naturopath. You don't necessarily have to buy an expensive detox formula. You can do these things naturally just by sleeping on time. You allow your body to wake up in the Brahma Muhurta time, which is the natural elimination time slowly follows. So if you're properly eliminating, you're using small things like trifla, you're drinking lukewarm water in the morning, you're going to achieve a natural state of detoxification. You enhance these practices around the seasonal time so you can eliminate ama. Because what is ama? It's nothing other than a buildup of toxins. These are the same toxins which build up in our arteries and block our arteries. So with a constant practice of elimination and getting rid of ama, we're going to improve our overall physiology. It's like lubricating a car. Why do we get oil changes on our car? We get them because the filter is loaded with junk from the streets and everywhere. You clean the filter when you clean the oil because you want everything to flow properly. Same in our bodies. Everybody's going to be drinking ghee today. We're lubricating our system, right? Allowing us to eliminate toxins. Exercise moderately and regularly. The Ballard principle in Ayurveda says that you must exercise every day, but you don't need to go ham with it. You can do to half of your capacity. If you exercise to half of your capacity daily, it will lead to longevity in your exercise practice because you're not going to injure your joints. You can do it daily without strain on your muscles and continue to do so for the rest of your life. Walking briskly 30 minutes in the morning is one example. At the American Heart Association conference last week, there was a recent study. We know the benefits of exercise, but the new guideline is moderate exercise at least 150 minutes per week significantly brings your risk of heart disease down by reducing diabetes, high blood pressure, obesity, all the rest. Cravings for smoke, all those things become reduced with exercise. So moderate exercise, 150 minutes a week, or if you're very athletic, 75 minutes of vigorous exercise once a week will bring your heart disease rates down. For children, actually, they should be exercising 3 to 5 times a week, and for longer than adults. But as adults, we can kind of bring it down so we don't injure the joints, but you must sustain it. Patients often ask me, well, can I take Sunday off? And I used to say yes, and now I don't. I said, no, you're not taking a day off. And the reason, I know our bodies need rest, yes, but the reason I don't allow them to take a day off is because then psychologically they're always looking forward to the day off. They're like, oh, Sunday, I don't have to exercise. But if they do that, it's creating a culture of not liking the exercise, and you don't want to create an aversion to it. You want it to become a part of your lifestyle, just like grocery shopping or cooking. It has to be part of your everyday lifestyle so that you're not afraid of it. It becomes a habit and you enjoy doing it. So that's why I don't give them time off. So they hate me right now, but especially since the last conference. But get your Z's. You have to sleep. Rest is important. Now the Brahma Muhurta time, is everybody familiar with what that is? The time of the Creator. So it roughly happens, this morning it was between 5:45 and 6:30. But it's roughly 48 minutes in the morning, which happens an hour and 36 minutes before sunrise. So you Google what time sunrise is for you that day, because we're not so intuitive to know exactly when sunrise is happening. We're not yogis yet. So you Google the sunrise time, and an hour 36 minutes, right up into 45 minutes before sunrise is the Brahma Muhurta time. It is a Vata time because Vata occurs between 2 and 6. And it is the time when Vata is most easily pacified. So your mind is most likely to be calm during this time. And that's why the whole old adage says, early to bed, early to rise makes you healthy, wealthy, and wise. Because you're able to really enhance your health, your mind, your spirit, your body, your whole connection with the universe during this time. So I challenge you to try getting up during Brahma Muhurta time for the next month every day and see the changes you'll see in your physiology. If you can do some yoga practices, breathing exercises, something during that time, it'll greatly enhance your health practices. So these are my 7 common sense ways to keep your heart healthy. This is just a summary slide looking at emotional health, physical health, everything coming together with the heart. And I wanted to kind of spare you guys some time in case you have any questions. Sure.
Okay. I was very surprised to see that you mentioned fever.
Fever?
For kapha rogas.
For kapha rogas,
Yes.
yeah.
Do you think it's a way for the body to imbalance the lack of pitta for kapha people?
Absolutely, it could be because they're perspiring, they're losing water element, so it could be decompressing kapha in that way.
And bringing some fire in the system?
Absolutely, yeah.
My second question was about the idiopathic, unexplained disease. You mentioned karma, of course we know about that, and we know that emotional, how can I say, thoughts and negative thoughts or difficulties. It's not only negative, it can be also like an imbalance in love life can create also the heart disease. When you cannot give allopathic diagnosis to your patient, are you able to go to that level of exchange with them? Are they open enough for you to tell them, well, I cannot explain that this way in an allopathic way, but this, there are unexplained things as well, or things we can explain, but at other level. Are you able to exchange that with the patient?
Yes, absolutely. So it's always important to have the discussion that something led you to this. We may not have a medical answer for why you have this. We're going to treat it regardless, and we need to understand how to at least maintain your health and what is happening in your life that could be contributing to you feeling this way. So we do have these discussions. It can be very in-depth or it can be on the surface. It depends on the receptivity of the patient, and you sort of have to just feel it out.
Thank you very much. Thank you for your presentation. It was
My
very
pleasure.
interesting.
More questions? Can you just put your hands up? I just bring them up.
I just have a general question in regards to the conference as a whole, but also for your presentation, if it's possible to have it accessible, the presentation
Sure.
accessible.
Are you?
Yeah, you can take notes.
Okay.
And with the rest of the presenters, I don't know if that's. I know a lot of people like.
Did we post it last year?
Slides.
Did we post it last year? I don't think we, but this year we're
This year we
on the
That
conference.
would be amazing.
Okay. We have to get permission from each speaker usually, and then once they agree, then we can release. You can certainly have mine. I'll send it to you. Okay.
I just want to know the pathology of heart trauma.
The pathology of a heart murmur. So let me bring you back to that anatomy slide there at the very beginning. But basically a murmur is essentially a sound that the heart makes whenever there is any turbulence of blood flow anywhere in the heart. So it could be across a valve, it could be against a muscle, it could be against one of the cords, it could be in the great vessels. But it essentially means there's some type of either turbulent, chaotic flow, either it's going in the wrong directions or the chamber is too narrow and the flow is being squeezed through there, so there's not enough space for it to go. So we can see it in a floppy valve where the mitral valve, for instance, should open and close kind of like a V. But sometimes the blood flows backwards and it causes a regurgitation, so it's going against the normal flow. So you hear that as a murmur. Another scenario is where the aortic valve is stiffened or tightened, so you have a calcified aortic valve that's very narrow, and the blood can't get out to the rest of the body, so you hear again very turbulent flow. The murmurs are different sounds. We classify them in 6 ways. So you have a grade 1, 2, 3, 4, 5, 6, 6 grades of murmur depending on intensity. But we also look at the sound, the direction in which it's flowing, the character of it. Is it high-pitched, low-pitched? Is it musical sounding? It tells us how much calcium is there, and what's associated with it. So you can really get in depth with a murmur to try to figure out what it is. And all of these diagnosis skills came out far before any technology came with echocardiography. Now we just put the echo on the chest and we know exactly where the murmur is, but it's kind of cheating. It's still nice to listen and understand what it is, so that's a murmur. Sure.
I'm kind of curious about the effects of trauma with. I'm curious to know the effects of trauma in the sense of firefighters, EMS, and living this sort of stressful.
So emotional trauma or physical trauma?
More emotional trauma, like PTSD and things like that. The effects of those on the heart itself.
So yeah, absolutely. Again, it comes back to emotional health.
Yeah.
So the ojas, the fundamentals of ojas is we must have emotional balance because it can affect all 7 dhatus, and how it does that is usually through vata aggravation. So anxiety, stress, fear, all these emotions that are not suppressed. Fear, of course, you don't want to suppress it, but you need to naturally release it. These things are vata aggravation or a vegya, dharnya suppression of an urge is not happening. So they create a vata aggravation or vata imbalance. And any vata dosha, again, is going to either cause a problem of its own, where the air actually replaces the blood in the heart. Actually, that's thought to be a vata aggravating condition. It may not necessarily lead to heart failure unless you have a genetic predisposition, but you may cause stress, inflammation, pushing the blood, high blood pressure, which is vata, and any plaque that's sitting there now is more susceptible to rupture. So it's all linked, but again, vitiating conditions.
Over here. Can you talk a little bit more about exercise and are there any contraindications to exercise in some patients, in certain cases?
The only time I limit their exercise, and I limit it to perhaps less than what they're comfortable, less than what they can do comfortably, is if they've had a recent surgery, if they've had a recent heart condition, and we're allowing the stent or the surgical sutures to stabilize, because they need at least between a 90-day and a 6-month healing time before they can really exert themselves. Also, young children who have congenital heart diseases, who have a weakened aorta or aneurysms, they are more susceptible to rupture. If they exercise, they can suddenly rupture. So sometimes we'll see patients coming in to do a stress test. The family doctor says, hey, check your heart, go do a stress test. But now I always listen to the chest before I put them on the treadmill, because sometimes you'll hear a murmur. And you may hear a murmur because the valve is too narrow for exercise, which could cause sudden death on the treadmill. Or the aorta is too big and it could suddenly rupture. So there's a lot of different conditions where you may not want the patient to exercise. But in general, if they're otherwise healthy and the heart looks good, I want them to exercise.
Thank you, Vineeta, for a wonderful presentation. My question is, as an allopathic and Ayurvedic practitioner, you're sort of integrating together, how do you address the extensive use of statins? And sometimes it's needed, I guess, if somebody's cholesterol is really high. But what happens when it's just given as a prophylaxis? Because something they have family history, and the doctor doesn't want to take a chance. And we know so many side effects of statins, which would eventually lead to perhaps increase your risk factors for heart disease anyway, especially with kidney function impairment. And also some people have reported, actually there's been a lot of studies done on people on statins. They are not able to exercise because they have muscle weakness. So how do we deal with this?
Yes.
And especially ACE inhibitors as well, with coughing and all that as well. So
this is thanks for the question. Great question. This is an inevitable question. Actually, I was surprised that nobody asked it sooner. So I was waiting for this one. But statins are a big controversy and have been for a long time in the non-allopathic medicine side. In the allopathic side, we use them very readily. Yes, they have side effects. They can have myalgias. They can result in liver dysfunction. Liver dysfunction is actually extremely rare. I have hundreds of patients on statins, but I'll explain to you why. Along with you, I agree that sometimes the side effects are unbearable, and I don't want to expose my patients to the side effects of statins and the problems that come with statins, the low coenzyme Q10, etc., the list goes on. But what we know about cholesterol since the 1970s, and this is all evidence-based medicine, so keep in mind in Ayurveda, we're looking at a cocktail per patient and not so much large masses of groups getting the same treatment. Everybody gets a different treatment in Ayurveda, whereas in allopathy, we're looking at thousands of people and seeing what the result is. So since the 70s, looking at the 4S simvastatin trials, some of the early statin trials, there has been a gradual reduction in cardiac disease the lower and lower we get our LDL. So what we know in life is it's a linear correlation. The lower you bring your LDL down, the less chance in the next 10 years that you're going to have a heart attack or stroke. And that's because we're reducing the amount of circulating LDL in the bloodstream. And by removing it from the bloodstream, we're preventing the buildup of arterial plaque, which can then lead to blockages and rupture and cause thrombus and hemorrhage in the artery wall. So we're reducing heart disease by reducing LDL. So now the question is, many people think, okay, why do we need to lower our cholesterol? We need cholesterol in the body. Sure, we need cholesterol in the body. In fact, all of the organs depend on the blood cholesterol to bring it into the organ. But our bodies don't need the amount of cholesterol that we're currently circulating with our Western diet, with our North American stresses, with all the habits that we've built out. We don't need the LDLs that we're seeing. If you look at a fetus or a newborn, the LDL levels are extremely low and the body is balanced and fully functional. By the time we reach adulthood, the LDL levels have risen, and now that extra cholesterol is just depositing in the arteries. It's a kapha imbalance depositing in the arteries of our whole body. If they deposit in the small coronaries around the heart, it can lead to a heart attack. It can lead to stroke if it's in the neck. So we need to lower the LDL that much. We know from allopathic medicine. The only ways, it's not that we think, oh, statins are the best. The only way we've known how to do it in the last 30 years that has been scientifically studied is in Ayurveda with Gugulu or in allopathy with statins. In the 1980s, then we added ezetimibe. In the past, we used niacin, we used bile acid sequestrants. We try to use things that are non-statins to lower the cholesterol, but nothing seemed to lower it 40 to 60% like statins did. Statins showed the greatest benefit in reduction of heart disease and stroke, and that's why so many practitioners have used it over the years. The most recent data, the most recent drug that came out 2 years ago is called a Pcsk9 inhibitor. Has anybody heard of this? It's a new injectable cholesterol drug. Basically, it's an injection that you receive every 2 weeks. It lowers your LDL to almost negligible. Now, granted, when medicines come out, we don't know what the 10-year outcome is. We don't know if 10 years from now we're going to say, hey, this is causing cancer or this is causing some extreme disease. But we know right now that it's lowering LDL to almost undetectable levels, and the risks of heart attack and stroke are going way, way down. The same patients that I had who had repeated event 3-4 times a year are now having nothing and have been stable for 2 years on a Pcsk9 inhibitor because I've removed essentially the cholesterol from their bloodstream. Now their job is to work on the stress levels, the inflammation, and everything else. It's an expensive drug and it only recently received coverage. So people are only getting it if they've already tried a statin because that's still considered first line. So does the brain need cholesterol? There's been this argument, what about dementia? Do statins cause dementia? Statins don't cause dementia by removing cholesterol. They cause dementia through some other molecular property that we don't fully understand. The brain actually produces its own cholesterol and fat. The brain doesn't depend on your blood cholesterol at all. So it doesn't even cross the blood-brain barrier. So by removing it from the bloodstream is having no effect on the brain cholesterol or the brain fat. The dementia that's caused sometimes that we see with statins is older age, and it's some other mechanism we don't fully understand. I mean, granted, medications have problems and side effects. They're not as brilliant as plants and herbs, which are in their natural state, but it's the best therapy we've had so far to lower cholesterol, lower heart disease. And the goal, given that it's the second leading cause of death, was to really try to eliminate the burden of heart disease. And so that's why the statins are a huge popularity in modern medicine. But they are slowly going to fade away with the advent of these Pcsk9 inhibitors, which have a completely different mechanism. Basically, the Pcsk9 inhibitor, we naturally have receptors on the surface of our liver which are constantly pulling cholesterol out of the bloodstream. The Pcsk9 inhibitor allows those receptors to work better so we can scavenge the LDL that we don't need and remove it. So it's not affecting the liver. We're not seeing side effects so far, at least. Not good.
Hi, thank you so much. I really enjoyed this presentation. When you were speaking about LDL cholesterol, just made me think about saturated fats. And I was wondering if you could speak to sort of the dietary thoughts or recommendations surrounding it, because you hear so much in the media, and especially with the coconut oil. And
Yes, definitely.
It's so high in saturated fat, but there's benefits too. So
That's a fantastic question. So in the 1950s, there was a scholar who wrote numerous papers on how fats are not the enemy, carbohydrates are the enemy, and everybody sort of ignored him. I think he was in Europe somewhere. Everybody ignored his papers and said, what is he talking about? There's obviously fat in the arteries, so fat has to be the enemy. So they made a conclusion by natural progression that, okay, fats must be accumulating, we have to eliminate fats, let's get rid of fats. And for the last 40, 50 years, doctors have been telling patients, reduce your saturated fat, reduce this, reduce that. And coconut oil was even on the list, eggs were on the list, everything was on the list. And so what we've realized in recent papers in the last, I would say 5 to 10 years, is actually carbohydrates are really our enemy. And it's not the natural source of carbohydrates, which is our natural sugars. And again, I go to the point of keeping your foods as close to nature as possible is going to keep you most healthy. Because the processed sugars that we have are enormous in our diet. They're in everything in our foods. And we go in the grocery store, first of all, everything's packaged full of inertia, sitting on a truck imported from somewhere. By the time you get it, what vitality is left in We're unlucky in North America. Everybody wants to live here from other countries, but I keep saying, no, you guys are doing way better. The food in Europe is fantastic. Have you tasted oranges in India? They're just so good. You know, so we're really at a disadvantage here. We have to be so creative with our food. So moderation is key. Carbohydrates are the enemy. We have to eliminate sugar. Why do we have to eliminate sugar? If we're consuming large amounts of sugar, your body's going to see this extra sugar and it's going to say, hey, I got all this sugar, I'm going to use that as my fuel, right? But if you consume less sugar, what does your body have to use for fuel? It has to use fat because it has to sustain the protein and the rest of the metabolic functions. You want to shift to be able to use fat in your body. And how do you do that? You give it a little bit more fat and less carbohydrates. I'm not saying go crazy with saturated fat. Avoid deep fried foods, avoid saturated fats if you can. But the good saturated fats, the plant-based ones, the ones that are occurring in nature, the problem with coconut oil is it's in a very highly concentrated form that you might not eat in a coconut. You're not going to eat that much fat in a coconut. Can you eat a full coconut? Try. Okay. If you can't eat a full coconut, you probably shouldn't be having super amounts of tablespoons of coconut oil either, right? So try to keep it as close to nature as possible and you won't go wrong. That's the idea. And don't trust every package that you see, organic, coconut oil, etc., etc. You know, just bring awareness to your body, close your eyes and say, do I need this? Feel it, how you feel after you eat it, pay attention. Eat quietly, don't eat in groups. Pay attention to what your body's saying and you'll get most of your answers right there. So moderation, essentially. Sorry for that long-winded answer.
Yeah, I agree that moderation. Because I always prefer to all my patients also.
Moderation.
And, moderation, that is what we call that one part of brahmacharya also.
Yeah, absolutely.
So brahmacharya is not, generally people connect it to celibacy, but it's wrong. So following certain rules and regulations in your day-to-day life, that is the real meaning of brahmacharya.
Yeah.
So you apply everywhere, automatically you can live happily. So my question, thank you for the very good presentation. And which spices you prefer or suggest, which reduces or removes the blockage?
I think it's very...
Somebody say garlic is good.
Yeah.
So what is your opinion?
Garlic, okay, there's... Garlic in actually yoga context, garlic is considered a poison because it suppresses your natural ability to raise your consciousness. So garlic, onions, peppers, hot spices. But in Ayurveda, you have to use seasonal spices for sure. So warming herbs that are going to bring kind of some of the vata down. You have to use those herbs such as black pepper, turmeric probably all year round you could use. Specific spices, it really depends on the individual and their constitution. So, but in order to remove ama, there's nice detox cleansing teas that you can use on a seasonal basis. And they are tridoshik. So they basically contain, our ajwain seeds, which is the celery seeds, coriander, black clove, cardamom, what else is in there? Cinnamon and fennel seeds. So when you combine all of this in a tridoshic way and you boil it and you sip it, it becomes a very natural ama cleansing and it can be used seasonally. It can be used all year round, but if you sip this through the year, it helps to cleanse some of the ama. It digests the undigested particles and eliminates that so it doesn't deposit. So there's various things you can use. That's a general one. And then specific herbs can be used in different constitutions depending on their dosha.
What was the name of that tea?
It's sort of self-subscribed, so I can write down the recipe for you because I use it. It's a flu buster. It's if you first sign of a cold and you drink it, it just boosts your immunity. I love it. Actually, Dr. Ishmat Nathani was the one who taught us that at Keish, and I've modified it a bit for my own Vikruti, but you can also modify it for yours. So I'll give you the basics, and then you can modify it depending on how you see it.